This is Oral Intake History for Merlina Corbett. Hello, my name is Merlina. I'm a nurse here, and I would like to assist you with your visit today. I'd like to first start off by asking you to confirm some information. Would you please verify that this is your address
Yeah, that's correct.
and your date of birth?
Yeah.
And may I call you by your first name or your surname?
First name's fine.
And the first name is, can you please verify it is Denver?
Yep, that's
Thank you.
correct.
Okay, so Denver, can you please state how old you are?
38.
38, and you are male, correct?
Yep.
Okay, and would you mind sharing your marital status with me?
Married.
Married, okay, thank you. And what do you do for a living, Denver?
I fix houses.
Fix houses, okay. And do you live in an apartment or a house?
House.
Okay, house. And what culture do you identify with?
I don't know. I don't think we really think of stuff like that.
Okay, thank you for that. So what brings you here today, Denver?
I have had a headache, and I hit my head at work at one point,
Okay.
and I thought it would go away, but it hasn't gone away.
Okay, so this headache, do you know when it started?
I think last week.
Last week, okay. And then how has the pain been happening since last week, or has it subsided a little?
It's off and on,
Off
but
and on.
mainly when I finish my day of work.
Okay, and then these headaches, can you describe the pain for me?
Dull, achy.
Dull and achy. Does anything make it worse?
Yeah, the more I move.
The more you move? Okay. And what type of movement are you doing?
Well, all sorts of stuff on a ladder,
Okay.
walking, crawling, bending.
So anytime you move, it makes it worse?
No, it just hurts more when I do that. The more I do that in a day.
The more that you move in a day, it hurts?
Yeah, when
Okay.
I get home.
Okay. And have you taken anything for that?
Just Tylenol.
Just Tylenol. Okay. And have you lost any vision?
No.
No. And do you, when you do work, do you wear masks or eye protective wear or anything like that when you're working?
Yeah, whatever is required.
Okay. Well, thank you for letting me know. I'm going to ask you a little bit about more about your body and a little bit about your history and what's going on with you to get a better idea of what is going on. Okay, so going back to your headaches, is it radiating anywhere else, like any other places in your body?
No.
Okay, so are you taking any medication?
Yeah, I take a blood pressure.
Okay, do you know the blood pressure name? Does it start with a Pril
Or
like
chlorothalidone.
Chlorothalidone, okay. And do you know how much you take?
I think it's like 12.5 milligrams or something like that.
12.5 milligrams. Okay. How often do you take
Daily.
that? Daily. Okay, when was the last time you got your blood pressure checked?
At my regular primary care doctor visit.
Okay, and was it pretty normal?
Yes.
Okay, so no problems. So, do you have any other issues besides the blood pressure?
Nope.
Okay, so I'm going to ask you about, do you have any allergies?
No.
Okay, so I'm going to ask you, have you ever a little bit about your past? Have you had any surgeries?
Yes.
Okay, can you tell me about those surgeries?
I had necrotizing fasciitis in my right arm,
Okay,
and some other minor infectious disease stuff, but
Okay.
that was the big one.
okay, and when was that?
October 2nd, 2010.
Okay. And have you had any issues with your right arm since then?
No.
Okay.
No. Not, that's been a long time.
Okay, what about any accidents?
Work-related injuries, but nothing too bad.
Okay,
Just Band-Aid and stuff like that.
so no major?
Nope.
Okay. So I'm going to ask you a little bit about your family history. And I'm going to ask you some about diseases that are just possibly, just concerning, and we just want to know about them. We're just talking about your mom, your dad, your grandparents,
Okay.
your aunt, uncles. So have any of them had a stroke?
No.
Okay. Diabetes?
My brother?
Brother? Okay. Has any kidney disease?
Nope.
Okay. What about maybe a little bit more personal? Any mental disabilities like schizophrenia, bipolar, anything like
Nope.
that? Okay. So going back to your brother, he has diabetes. Do you know if he has it 1 or 2?
1.
Okay, 1. And do you know when he was diagnosed with that?
I think like 5 years ago.
Okay, and how old is your brother?
41.
Okay. I'm going to ask you a little bit about the rest of your body. So I know that we talked about your head, bothering you, but what about your neck? Has anything wrong with your neck or any of your shoulders or anything like that?
No.
Okay. Have you had any problems with the seizures?
No.
No. What about sleeping?
Yes.
What can you tell me a little bit more about your issues with sleeping?
Just toss and turn.
Okay.
Can't get comfortable.
Okay. And how long has that been going on?
A couple weeks.
Okay. Would you say that this has been going on before the accident work last week or after?
It's gotten worse.
Okay. Okay. How would you describe your outlook on life? Are
Good.
you happy?
Yep.
Yeah. Okay, that's great. And so do you have any weakness or tingling or numbness in your body?
No.
Okay. And when you stand up, do you feel dizzy or?
No.
Okay, great. Good to know. And how about your breathing? Do you have any problems with, breathing in or breathing out?
Nope.
What about when you're lifting heavy things and you're carrying a lot of things? Does carrying things up the stairs, how does that happen? How does that go?
It's fine.
Fine. Okay. And do you smoke?
Nope.
No. Okay. Have you smoked?
Yeah, in the past.
Okay. How long ago did you quit?
6 months.
6 months. Okay. And then how much did you smoke?
I vaped.
Oh, okay, you vaped. Okay. Okay. And do you have any history of asthma?
Nope.
Oh, so I want to talk about your chest. Do you have any chest pain?
Nope.
Okay. Do you have any chest pain with activity?
No.
No. Okay. Do you exercise?
Yep.
What kind of exercise do you do?
I do construction.
Okay.
Every day.
What does that entail?
Everything that until when you see somebody building a house.
Okay. So are you lifting heavy things?
Yep.
How heavy do you think the things are that you're lifting?
Up to 120 pounds.
Okay. And do you use good body mechanics?
Yep.
Okay. Okay. And have you had your cholesterol checked?
Yep.
Okay. When was the last time you got it checked?
Last month.
Okay. Was it normal?
Normal.
Okay. Can you describe your general diet? Do you eat fruits and vegetables a couple times a week?
Yeah.
Okay. Do you eat a lot of junk food?
Yeah.
Yeah?
Yeah.
Okay. What kind of, do you tend to eat more junk food versus healthy food?
I think it's a mix.
A mix? Okay. Have you gotten checked for diabetes?
No.
No. Okay. I would encourage you, considering you have that family history of your brother, that you would probably get checked the next time. It's really easy. It's a blood test. Just, talk to your physician about, possibly, especially if you start, urinating more, getting thirsty more, those are big contenders. So, do you have any constipation or diarrhea?
Nope.
Okay. And do you have any heartburn?
Nope.
Okay. So speaking about, constantly having to urinate, do you have any problems with that?
Nope.
times do you void?
5 times, 6 times a day.
Okay. Alright, do you drink plenty of water?
Yeah.
Okay. And then do you have any sexual problems?
Nope.
Okay. What about your construction worker? So you're lifting lots of stuff. So do you have any problems with your muscles?
Nope.
What about your joints?
Depends.
Depends on what?
How much I work.
How much you work?
Yeah.
Okay. So if you work too much or or the job is strenuous, does that mean that your joints hurt?
Sometimes.
Okay. Do you take anything for that?
No.
No. Okay. So what do you do to alleviate that?
Just push through.
Okay. Okay. Have you spoken to anybody about that?
Nope.
Okay. Have you thought about maybe involving yoga to stretch your body before or after a
No.
job? No. Would you like information
No,
about
thank you.
Okay. Do you have any bone problems?
No.
No. Okay. And do you know what a DEXA scan is?
No, I don't know what
Okay.
that
It's
is.
to test for osteoporosis.
Oh,
usually,
yeah.
okay, usually happens when you're a little older. And then what about your skin? Do you have any skin issues?
Nope.
Okay. So to recap, Denver, you're a 39-year-old man. You're here regarding headaches to your that you sustained after a work injury a week ago. You have a family history of your brother with diabetes. You have had a previous necrotic fasciitis on your right arm. No major accidents, and you quit smoking the vape about 6 months ago. You have no chest pain. Is there anything else that you would like to add?
No.
Okay. Thank you.